Hello, everyone. Welcome back to the Life as a Patient Doctor podcast. My name is Dr. Moss, and I am a psychiatry resident physician. Today, I'm going to share how I overcame step 1 failure and matched into residency. I was so thankful that I reached over 1,000 subscribers and followers, so I didn't ask me anything on Reddit, email, newsletter, on social media, and I'm so thankful for all the questions you've sent me. I've consolidated them. In this episode, we're just going to talk about the failure and into matching residency, and other videos that I'll record. I'll answer the other questions you all provided, like what does residency look like, especially what does residency look like with my husband and I being both resident doctors. He's a neurology resident, also Dr. Moss. Today, I'll be incorporating questions that I've been receiving both when I meet one-to-one with medical students who are applying to residency or just trying to get over that failure. To start, my journey into medicine and through medicine was very similar, I'm sure, to yours, filled by passion, determination, and sacrifice. Looking back through medical school, definitely very grueling, a lot of self-doubt, a lot of imposter syndrome, but I kept going, didn't let different struggles like failure keep me from trying again and being able to eventually pass step 1, step 2, and apply and be successful and now be in the residency that I'm most passionate about. So starting with the step 1 exam, obviously step 1 had a lot of pressure and anxiety surrounding it. We all have it. And then, of course, I had to deal with, at the same time that I was taking the STEP exam, COVID started. I had to take a leave of absence because I wasn't passing my practice exams. And on the test day, even though I felt like I was prepared, it was definitely an emotional roller coaster. All that anxiety, that pressure, that struggle financially, I wasn't prepared that I would fail the exam. I took it in December of 2021, which was the very last time I could take it for a scored number. My school told me I had to take it by that time because I still had to do it under the number system. Unfortunately, I failed by 1 point. So the score needed. And so then the next time I took it, I have to do officially pass fail. And it was definitely an emotional roller coaster. I felt devastated. I had so much despair that I was so close, 1 point away, but still not good enough. All of that imposter syndrome, the self-deprivation, these struggles that I've dealt with my entire life. Maybe this is a sign that I should give up, that I'm not supposed to be here in medicine. And I'm glad I didn't stop. One of the first questions, and I combined a lot of these questions because a lot of them were similar, was how did you overcome failure? And how long did it take you to retake? So the very first thing I recommend to all medical students who have recently failed is to stop, pause, and step away from studying. It's hard because you just want to get it over with. You just want to go in, try it again. Either that's to jump back into school or clinicals, but that's where people fail the second time. That's what happened to me. I didn't take the proper rest, emotional rest that I should have. I was having a lot of financial problems by no longer having student loans because I was on a leave of absence. So I started working multiple jobs and at the same time studying. A lot of emotional stress, not sleeping well, not eating well, not exercising at all, not really taking care of myself. And so one of the biggest things I always tell medical students who fail is pause and step away from the exam. That can be a week, a month, or more. Every single person is different. And then once you're ready to go back, that's where you can start figuring, okay, let's come up with a new plan. After I was able to process my emotions, I was able to figure out, okay, what went wrong? What did I need to get that just 1 more point and higher? Because I didn't just want to barely pass, especially with the idea of pass fail. I knew that they were increasing the score needed to pass. I tried to make myself have all my practice exams above 10 points passing to know for sure that even if anxiety came in or I forgot certain things, I would have enough buffer to still pass the exam. When I meet with medical students who are struggling, I also recommend them that practice exams above 10 points passing. One of the things I looked back upon was that I spent more time doing passive learning instead of doing exactly like the exam. I've said this in other STEP videos, and STEP were tested on questions. So in order to do well on questions, especially if you're not a good test taker like me, is to practice with questions. Number one resources, always UWorld, because it's the one that most closely mimics. Now, of course, there are other ones that you definitely want to incorporate, like the NBME practice exams. So definitely also add in those for practice questions. But questions and doing a lot of them, not just a couple here, a couple there. You want to practice just like the test, not in tutoring mode. You're in active practicing. It's usually 40 questions in an hour. Now, this is where I go into accommodations. You can see the video that I did on accommodations, and that was a big game changer for me because I realized that my mental health and physical health did not allow me to sit for 8 hours and step 2, 9 hour, and step 3 over 2 days exam. So it was very important to me to get accommodations, and you can check the other video to go to see if that is for you. They take about 60 days. So already I had 2 months to really study and focus on that, and a way to get me to not take the exam right away. And then failed again when I eventually took it a second time. Okay, so I did questions. I got accommodations. What was going on? Why did I fail again? I even did practice exams, and you can see my blog post where I go through every single practice test that I did, and you can see my score. I was so sure I was going to pass, and I did it. Failed again by 1 point, and it was higher because every single time I took it, they were increasing. But anyway, again, take a break, reset. What was going on? Okay, let's go to another question. What do you think you needed to do differently in your prep to pass STEP? Were you rushing, or was there something missing in your revision? It was my health and my mindset. I wasn't just focused on the exam. Like I mentioned earlier, you can look at my leave of absence video. There were so much other things going on in the background. So it's very important that you're not working, you're not doing other things. You're not volunteer, even though you want to. Sometimes it's good to do here or there a volunteer shift or a shadow shift. But if you do so many things that you're not studying, you can get distracted. Now, I sometimes recommend medical students to do one thing once every couple weeks, a couple hours a day, but over 40 hours a week, which is what I was doing, plus studying, that wasn't going to happen. Of course, I didn't pass because I wasn't putting my full mind into studying. It was difficult, but we had to pause for an additional month where I didn't work, finally was able to pass. So important to lean on my support structure, which was so important when I was in third year of medical school. And of course, now when I'm in residency, that looking holistically, taking care of my health, looking at what's important, bringing in support system, and being with individuals that bring me joy and doing things that bring me joy, in addition to taking care of my mental, physical health, so important. Okay, another question. I'm a Latina here, also like you, with one failed step 1, which made me feel very demotivated about continuing in this path. I'm worried that one failure is going to be a red flag. What extra things did you do to improve your application? Okay, perfect. Now we're going away from just failure of STEP. You can look at my other videos. If you just want to focus on STEP, you can look at my step 2 video, which even talks about if you failed step 2, what are things that you can work on. Okay, biggest thing overall is to have a holistic application and demonstrate your strengths and any lessons that you learned through this failure. Failure is just a step in the road. Turn it around and see it as a learning experience. And there's another video that I did called Red Flags, where I discussed how to talk about leave of absence, failure, retaking a year. It's all about how you talk about it in your application, both written and verbally in the interviews. I've worked with a lot of medical students, making sure that their application really highlights their strengths and make sure that they're honest about their failures, what they learned from it, and how they're going to make sure it doesn't happen on, let's say, step 3 or on their board exams. And usually there's stuff, whether if that's mental health, physical health, not studying right, other external factors going on, there's always something that we can grab and learn from. Additionally, it's very important, especially if you're applying to a competitive specialty or just a specialty that maybe you're scared that you might not have the chances or you have additional red flags. It's important to dual or triple apply. I created a video on dual applications, and really all that means, it just increases your ability to match. Hopefully that was helpful. Another thing is there's a specific location in the ERAS application, at least it was for when I applied, and this past year when I've been helping individuals, and we'll see if it comes up again, but I'm pretty sure there are 2 areas. One area asks about academic challenges that you can write about. Another one is different experiences that you have that were unique or special, and so that's a good place to write. Okay, so other things that I did to improve my application is I made sure that I had strong clinical evaluations during my 3rd and 4th year, strong letter of recommendations from doctors that had specifically seen me with patients doing clinical activities, made sure that if it was out in the community in one of my volunteer activities, they had seen me in those like leadership roles, and they specifically talk about those qualities that you want as a doctor. Also regarding research, because everyone always talks about research. At first I was really scared because I didn't have, when I was growing up, I was very set of research means in a lab, or research means like question, hypothesis, all that. And that's not the case. There are so many other ways that research is to show and educate the community, especially medical community, and also the community as a whole, the society. I've created a blog post where I talk about how important it is to keep doing what you love. You have limited time. You have only a set time between studying for your exams, your clerkships, all the stuff that's going on in medical school. So keep doing the thing you enjoy, and then you can turn that into research. You can turn that in a qualitative research. You can put out a survey to the other volunteers and create a poster. You can publish as an op-ed or a patient experience or a very meaningful patient encounter you've had during your 3rd year rotations. All these are ways to do publications and research. And it's so important, especially when you're about to apply. If you're currently a 3rd year looking to apply this upcoming cycle, it's important that you get those posters and go to those conferences, because that's where you're going to meet every single program, or a lot of them, a lot of the program directors, the residents at all these programs. So it's super, super important, because networking is huge. And talk about that in my videos. I'm referencing a lot of the other videos I have because I don't want to go too in depth on it, and I'm really just going as a summary as a whole. Okay, next question. Did they all ask about the step 1 failures in interview, or was there a place to explain? So I already talked about the place to explain. Let's talk about who talks about it. So not everyone who interviews you has your full ERAS applications, has your scores, has your transcripts. It's usually only the program director and maybe associate program director. So you can very confidently, if you're interviewing at all, that means that it was good enough for them. So if you get an interview, it's okay. They want to get to know you. So there's no need to talk about it. Step 1 failures, because no need to provide another thing for them to think about, because they didn't have your whole application. Like if a random attending or a random resident's interviewing you, there's no reason to say I failed step. It's just not helpful. Talk about the things you do well. Talk about meaningful, impactful experiences. So, okay, did a program director ask? Sometimes, yeah, but it was more to get clarification because I already did a really good job of explaining that failure in the different aspects of my application. So it was more, oh, I saw that you took a leave of absence or you struggled financially. What did that mean for you? You said you struggled, or you said you developed this strength. Can you talk more about it? Or how are you going to use that strength as a doctor or as a resident? Stuff like that. So again, just as a whole, very important to say what you learned from the experience and how you grew from it. Then probably don't need to touch on it again. Okay, next question. Based on the fact you are in residency with 2 failed step 1 attempts, I'm wondering why those in medicine convince us a failed step 1 attempt makes it impossible for matching. I couldn't agree more. I've thought about this, and it's hard because I was told multiple times by my medical school administration, doctors, residents, oh, you failed? Oh, you're not going to get it. You're not going to match. Oh, you're not even going to get an interview. And I got a lot of interviews and I matched in my favorite specialty. Some of it is just projection of saying, oh, maybe I struggled. There's no way with a fail that you'll get in. Or maybe they have an experience of, I saw one of my friends who failed and they didn't match. Were in the past, and it was so different. It was before it was pass fail, and already the past couple years there's been an exponential amount of individuals who failed step 1. And this is not like me just saying this. USMLE has came out and actually said people failed and they were adjusting the score. I received an email from USMLE saying, okay, what do you think is a good passing score? What do you think is too much, too little? They asked me all these questions in the survey. They specifically emailed me, both for step 1 and step 2. So they're actively analyzing what happened. Did they bump it up too high and then too many people fail? I don't know. So with that in mind, you're not the only one if you failed step. There are a lot of other individuals. So residencies are looking at so many other aspects of applications. It's no longer just scores. It's back to when medical schools used to be like ABC grades. Back then, that's what mattered. But now the majority of the schools just have a pass or fail. And so similar for step 1, they're looking at step 2 scores. If you're an IMG, step 3 is important. They're looking at applications as a whole and how you will do well in their residency. Okay, so going with more that this person asked me, what are the true consequences of people who fail step once or twice? Is matching into a specialty like neurology or radiology out of the question? Now I'm going to say, no, it is not. It is not out of the question. I know specifically individuals who were in my year who failed one of these exams and still matched in these specialties, one in radiology, one in neurology, a lot of internal medicine, family medicine for sure. And then, of course, I don't know everyone. And then we'll see next month if people I've worked with, that a lot of them did also fail, if they match. They got a lot of interviews. I'm very confident that they will. It's hard. And I don't know everything. I'm not a program director, so I cannot say that. I am not in these other specialties, but I do assist with the interviews in my program. We're actually meeting in a couple weeks with the program director about ranking for our program. We'll see what that looks like. But it really depends on every single specialty is different. Some of them value academics. Usually I would say more of the competitive specialties, but not really, because they are constantly changing. Different years, whether it's different individuals that are selecting to apply. Right now, psychiatry is becoming competitive because more people are applying. A lot of the 4th years and the fellows in psychiatry are like, it was easy to apply to psychiatry. I only had to apply to a couple places and I got in, because very few people were even applying to psychiatry. That's not the case right now. The past couple years, it's been an extreme amount of people applying to psychiatry with barely a couple increases in number of residency spots. That's why I'm saying it is competitive. And people are saying it's competitive to go to psychiatry because there's only set number of spots. Let's say there's 10 spots, and before there were 10 people applying to psychiatry or 8 people. Now there's still those 10 spots, but 30 people applying. Next question. I passed step 1 recently in my first attempt. but worry about how my transcript will be perceived because I did fail several exams while in med school. Is this considered a red flag? Ooh, very good question, because I've worked with students who had to retake a year, let's start with the easiest, failing exams. Sometimes it doesn't even show up on the transcript. Every school is different how they represent and they send scores. Some schools don't care, or a lot of residencies don't even care about the scores in first and second year because they just care that you've started the clinical rotations, that you did enough to pass step one. Or even when individuals have to retake a year, it's a similar situation. You explain what happened, you explain what you learned from it, you explain how if another challenge or similar challenge happens in the future in residency or as a doctor, you will take that experience and you've learned from it. So again, there's a section to write that. I don't recommend you write about your challenges in academics during your personal statement. Personal statement does go to everyone. We really just want to focus on the positives, your strengths, your values, what makes you. I know it seems like the end of the world when you fail. I was there. I totally get it. It seems like you have a big F, a big fail. I'm thinking of that movie, Easy A. No, you don't write that on your head or don't wear that failure. Step away. Once you get it over with, it's in the past. I keep saying it over and over to try to destigmatize it, but I could very easily just never say it, keep going with my life. There's a lot of attendings that later on have told me, yeah, I struggled with STEP. I failed an exam. And they never tell anyone because they're working attendings. That doesn't impact them. Patients don't come up to you and say, I heard you failed that one exam. I don't think you're going to be able to take care of me well. That's not the case. You pass it, you never have to think about it again. Okay, next question. How would a leave of absence affect your chances for residency match? Good question. Go to the video on leave of absence. I did one specifically on residency match. I'm going to update that because I have a group of medical students that do research with me. We just sent another survey to update that leave of absence to see how it affected their residency, their matching, different lessons, different demographics. The easy answer is that and I've been told this, I've confirmed this with program directors, in their computer, when they get an email or log in and get all their people that are applying, hundreds, sometimes like 1,000 people, they can choose, and they keep it a secret, they can choose how they order. There's a place they can pick. Oh, show me people that graduated medical school within 4 years or graduated in the past year. When you go to medical school for longer than 4 years, or you didn't apply or didn't interview this year, it gets more of a challenge, just like before. And I sound repetitive. Be transparent, explain the GAT, explain what happened. How are you productive? How did you take care of your health? Did you take care of doing more research? Whatever, explain it, what you grew, and how you're going to apply it in the future. I'm saying this over and over. Hopefully you remember this. Okay, we're in our final question. What would you consider as something vital for being able to successfully match, specifically psychiatry? Okay, perfect. Since I'm a psychiatry resident and I've helped a lot of individuals this cycle get interviews in psychiatry, both IMGs, TOs, individuals who have red flags. Right now, psychiatry is competitive because more people are applying that in the past did not. A lot of the fourth years and the fellows in psychiatry are like, it was easy to apply to psychiatry. I only had to apply to a couple places and I got in, because very few people were even applying to psychiatry. That's not the case right now. The past couple years, it's been an extreme amount of people applying to psychiatry with barely a couple increases in the number of residency spots. That's why I'm saying it is competitive. And people are saying it's competitive to go to psychiatry because there's only set number of spots. Let's say there's 10 spots, and before there were 10 people applying to psychiatry or 8 people. Now there's still those 10 spots, but 30 people applying. And what we're looking for people, not robust. We're looking for people that are able to look at themselves as individuals and reflect and articulate their values, their strengths, really look at themselves, be introspective. That is key, introspection, be able to look at themselves, because will be key during when we interview patients in psychiatry. We're constantly thinking, we're constantly thinking about our patients. We want to show that people are authentic, they are honorable, going through the key values. And then something important is make sure that if you have one of those challenges, do apply. Don't let failure be the thing that stops you. If you want my help, you can look at my website, medpsychmoss.com, to sign up for one of my personal statements, strategy, editing, ERAS. I have ones that we can do a full editing. I can be with you throughout the residency process, do one-to-one interview strategy, practice, mock interviews, and then there's also individual things. Hopefully that helps you. And I'm trying to remind you that it's not the end of the world. You will get through it. You got to medical school. You got to step one. It's just a bump in the road. It's part of your journey. I don't want to minimize your discouragement and pain, because I know what it feels like, but you're not alone. Keep pushing. Keep leaning into your support system. Tell someone that you're struggling, whether if that is a therapist, a best friend, reach for support. So if there are any other questions, please put in the comments below. I will link all of the videos that I referenced. Stay tuned to the other Ask Me Anything videos, where I'll talk about residency life as a dual doctor marriage. But let's follow this conversation. So make sure, if you haven't already, subscribe and follow. Specifically, if you are in the STEP process, I did a playlist just on STEP, so go and look at that. I also did a playlist just on residency, so look at those. So you can look, depends on where you're at. Same thing, a playlist just for leave of absence. Overall, setbacks don't define you. Thank you so much, everyone. You got this. I believe in you. Keep going, keep striving. Take care.